Thank you, everybody, for joining us today for the kickoff work in progress. We have a special guest, Chuck Lubelczyk, from Maine Health Institute Research in Scarborough, Maine. He's worked there for over 2 decades, conducting ecological research and public health surveillance on ticks and mosquito vectors in northern New England. He has a strong interest in invasive species management, island ecosystems, and the role of wildlife plays in cycles in ticks and mosquitoes, tick and mosquito-borne illnesses. He has a bachelor's of science in wildlife ecology from the University of New Hampshire and a master's in public health from the University of New England. Um, Previous president of the Northeastern Mosquito Control Association. Chuck is currently collaborating with Maine Center for Disease Control on coordinating state's arbovirus surveillance program and working with partners in Connecticut on a CDC funded community tick control project on Maine's islands community. He lives in Maine's mid-coast region with his wife, who's an oceanographer, Laura, a dog, and 5 ungrateful cats. His talk will be about 2 recent seasons, epizootic activities with Triple E virus in Maine, and the changes seen between 2023 and 2024, and then early cycles in Maine. So with that said, Chuck, you can share your screen and
Yeah, so I'm going to go over again, this is very much a work in progress project, kind of covering our activity for Eastern equine encephalitis virus that we've seen in Maine in 23 and 24. Primarily, we are so far dealing with an epizootic issue in both years, although in 24 we did have, at the very tail end of the season, one human case of Triple E show up in the state of Maine. So very briefly, Eastern equine encephalitis virus is a mosquito-borne virus, an alpha virus. The distribution occurs along Gulf and Atlantic coasts, from Canada all the way south to Florida. It is a highly fatal disease, primarily affecting horses in livestock. We, however, as I'll show in some of the data, do have other species as well that are affected. Primarily emus are showing up as a very important livestock species that is affected, but also other exotic birds such as pheasants and peacocks that we have had in Maine previously, and also things like alpacas and llamas as well are also highly susceptible. The reservoir for Triple E are avian birds, passerines, primarily birds such as thrushes are very important for maintenance of the virus. And you can see from this map that there is a fairly strong distribution along the eastern seaboard, but also in the upper Midwestern part of the country as well. They have had hotspots of Triple E showing up, primarily around the state of Michigan. Michigan, like many of the northeastern states, had a lot of activity in 2019 in both livestock and human cases, which resulted in quite a few fatalities. These are the reported cases for the U.S., reported from US CDC over the course of 20 years, 2003 to 2023. And you can see that as far as a vector-borne illness, in comparison to things like Lyme disease, the overall human case numbers of Triple E are quite low. You can see that some years we may have as few as 2 or 3 cases reported nationwide. However, as I said, in 2019 was a fairly high year for us, reporting, I think, close to 37 cases reported across the country in that year. So Triple E is like many of our mosquito-borne viruses. We have a bird and mosquito cycle where we have migratory songbirds coming up along the eastern seaboard in the springtime. These birds will have some of the virus in them that they're probably picking up coming through the state of Florida on their way north. When they arrive in their breeding locations, right about the time that the enzootic vector, the primary enzootic vector, Chiloceta melanura, is emerging from forested wetland communities. And these female melanura will bite infected birds, acquire the virus, and then in turn go on to bite other birds and kind of amplifying the virus in nature. Other species that may be an amplifying vector as well may be Culiceta morsitans, although this species, while very similar to Melanora in its habitat, aka forested wetland communities, is not generally as prominent. People don't generally do not collect this mosquito as much, and it probably has some capacity as a maintenance vector, but primarily Melanora is the real driver for this virus. At some point in the season, other bridge vector mosquitoes, such as Coquetida perturbans, various Aedes or Ochlorhynchus species, may be biting some of the same birds. Ochlorhynchus canadensis is one such Aedes species that will be biting birds, but then will possibly go on to bite mammals and possibly transmit the virus to animals such as horses or possibly people. Now, in this case, both horses and humans are dead-end hosts for the virus. We do not reservoir the virus very efficiently. But again, these are also the species, horses and humans, where we have a lot more clinical or veterinary health issues tied in with Triple E. This is just a photo of Culiceta melanora. It's a fairly nondescript species of mosquito. Nothing really striking about its coloration or banding. However, the forested wetland communities here, which you can see at the bottom of this slide, one such wetland community, and also going back to this original slide, the primary habitat feature that is most characteristic for this is the appearance of what are called hardwood crypts, which are low cavities underneath the root system of these tree systems. And these crypts do not freeze during the winter, providing the larval stage of Melanora to be active in the wintertime and existing in these crypt systems. These crypt systems, however, can occur in a variety of different forest types. So you may have red maple swamps, Atlantic white cedar, spruce bogs. Various species can contribute and have these habitat characteristics, which allow Melanora to thrive. And again, various vectors. We have bridge vectors that have been reported in the literature. Salt marsh species such as Aedes or Ochlorhynchus tinuricus and solicitans. Down south in Florida, Culex nigripalpus. And then as we get more to our area, some species, in addition to Aedes or Ochlorhynchus canadensis, we have Aedes vexans and Coquetida perturbans. Perturbans, at least for the state of Maine, perturbans is probably our most common species. It is commonly referred to as the cattail mosquito because the larval habitat tends to occur in areas where we have either cattail or reed flora that's growing up in emergent wetlands, providing ample habitat for the species. Perturbans is an aggressive catholic feeder. It readily goes after mammals, but also will feed on birds and is active day as well as at dusk. And Eastern equine encephalitis, however, from a virus standpoint, even though we have very few human cases reported nationwide, it is probably our most severe vector-borne illness that we see in the United States. 5% of the people who probably are exposed to the virus become infected. The incubation period lasts from 4 to 10 days, but can be longer in patients who are immunocompromised. And about a third of the patients who develop severe symptoms to Triple E will die, with about half survivors having long-term neurologic implications going out. And by long-term, we're talking about a decade out from initial exposure. So these can be very severe symptoms in people. For Maine, our issues with Triple E really started only about 20 years ago. We had our initial bird that was submitted for West Nile virus testing in southwestern Maine in the town of South Berwick. It was a goldfinch that was collected as part of a dead bird program, came up positive for Eastern. This was actually our first blip on the radar for this virus, despite the fact that the neighboring state of New Hampshire had a lot of Triple E activity going on in the coastal areas, not very far away as the goldfinch flies, going back into the 1970s. But we really did not have much activity here in the state until 2001. 2005, 2007, and 2008 were years of some activity where we began to have blips on the radar for equine cases. And 2007 and 2008 were also fairly active years in New Hampshire as well. For us, really, our seminal year came in 2009, where we began to see over the course of the season up to 15 horses, 1 alpaca, 3 raised pheasant flocks that were being raised for the hunting season, and then 1 translocated wild turkey that our Department of Inland Fisheries and Wildlife was transporting in order to establish new flocks in central Maine. All of these animals came up positive for Eastern between the years of 2014 and 15. We had two human cases, one a fatality reported in southwestern Maine, here in the town of Elliott, right down on the corner, right near New Hampshire. Um, as a result of these activity in 2009 and 10, we began to do a lot more intensive surveillance looking for the virus. So in addition to mosquito surveillance, we began to use the idea that cervids, which could act as a proxy for livestock, may be exposed to the virus. And if we examine these cervids, we could at least detect antibodies in these animals. And cervids, of course, being deer and moose in Maine. These are animals that are being brought into tagging stations or hunter registration stations each fall. We go in, collect a blood sample, and then we were working with partners at the federal CDC in Fort Collins, Dr. John Paul Mutebi and Joan Kenny, who were doing testing and doing PRNTs on these samples. And we were able to determine that, really we had a pretty good statewide coverage. Wherever we put in enough effort and had enough of a sample size of animals, we came up with some antibodies to Eastern in these animals. One of the real conundrums was that in many cases we were seeing activity, and you can see here the antibody prevalence by some of the counties where we're looking at, and we were talking some years greater than 20% antibody prevalence in some counties. Many of these are in areas where we have no recorded human or livestock cases of EEE, no veterinary activity, no human activity. So it's a real head scratcher, why we're seeing it as prominent in cervids, but we're not seeing much in the way of human or veterinary cases. The next slide, this is just a map showing the distribution. We actually did partnering with the states of Vermont and New Hampshire. We could see, and this is just a graphic from a kind of a summary paper that a bunch of us put together in 2022, was published in JMed Ent. John Paul Mutebi was the lead author on that, and we displayed out over the course of almost a decade worth of cervid data, mapping where we had positive and negative animals to antibody prevalence. And you can see that the distribution of positive animals, represented by the red stars, is pretty broad. And really, wherever we looked, again, and put in enough effort to get a high enough sample size, we had evidence of antibodies of Eastern showing up in these cervids. And again, this really outstrips where we have had any kind of vet or human case data coming in across all three states. In many cases, EEE for Maine, New Hampshire, and Vermont really tends to be restricted to very small foci that show up year after year. It does not appear to be widespread on the environment. And so this gets into our mosquito surveillance. And one of the things about this, I should go back to the slide. One of the reasons behind this is that this has helped us to, in some ways, focus some of our more intensive mosquito surveillance. Like many of the New England states, our mosquito surveillance resources really don't match up to how much effort, time, and personnel power is going into these surveys. And so we try to have the funds go as far as we can. And so we actually use some of this data from our cervid positivity to kind of inform where we may want to do more enhanced mosquito surveillance collections. And so in general, for the state of Maine, our mosquito surveillance season really stretches from July 1 to the end of September. However, in both 2023 and 2024, because of the large amount of EEE activity we saw, we actually did extend our mosquito surveillance into October. In 2023 and 24 as well, we actually started earlier because our Maine Health and Environmental Testing Laboratory has taken on Jamestown Canyon virus testing for the state surveillance program. And so we are doing some very limited collections now early in the season to look for JCV as well. So this new testing or new collections of mosquitoes would be considered our phase 1, which is focusing on JCV, going from May 15th, starting on May 15th. Phase 2 starts on July 1, and that's really where we begin to look a lot more for Eastern and West Nile virus. And again, for this early phase 2, we are really doing the enzootic vectors. So we're looking at Culiceta melanora and morsitans, Culex pipiens and restuans, and then the Culex pipiens restuans complex. And this will stay into phase 2 until about August 15th or so. However, we may kick into phase 3 if we have any neighboring detections in New Hampshire, or we find viral activity showing up in either vet or human cases in the state of Maine. Phase 3 incorporates many of the bridge vector species, and this is really just a sampling at the bottom here, such as Aedes cinereus, vexans, Colchicida perturbans, Culex salinarius, Oculoritatis canadensis and sollicitans, as well as the five original groups of enzootic vectors are included. And really, depending on the numbers, we may end up having more species come in. We certainly have years where, for instance, Staurophora ferox might be quite high. And even though it's not a common species, we have in most years, this one is one that if we get abundant numbers, we will include those in the state surveillance. So monitoring agencies in Maine really include our lab, the Maine Health Institute for Research. We work very closely as well with the Maine Department of Agriculture, Conservation, and Forestry, and then work with private companies such as Municipal Pest Management. And under our umbrella at the Maine Health Institute for Research, which is governed by these yellow squares, we work very closely with several UMaine campuses. Allie Gardner's lab up at Orono is one very important partner that we have. But we've also in the last 2 years been working with the Aroostook Band of Micmacs in Aroostook County up near the town of Presque Isle. And they have been working with us where we have a grant looking to train tribal students in using vector ecology, vector biology, and epidemiology as kind of a gateway into STEM field exploration. And so we're able to incorporate and get them working with our surveillance program. Primarily, we use CDC miniature light traps, resting boxes, and in interior urban locations, we do rely a little bit on gravitraps. Mostly the gravitraps, however, are being used to look for pesticide resistance monitoring data. And so leading up to the EEE activity that we had in 23 and 24, really the precursor to this really was looking at, this is a map showing the precipitation data from the Northeast Regional Climate Center based at Cornell. And really 2020, 2021, and 22 were all really regarded as very dry years. And in fact, 2022 was actually our third dry year in a row and one of the most severe where it was actually declared as a drought in many parts of the state going into August. That was a year where even some of the state agriculture department was worried because we actually had several wells that were running dry in various counties across the state. So it was a time when conditions on the ground were not very hospitable for mosquitoes, and our mosquito abundance was quite low, and we had no arboviral activity in those years in the state. However, in 23, we began to see a change. We actually began to get much wetter conditions coming into what would be considered our arboviral season, with June being a fairly wet month across a lot of the state, July being somewhat dry, but then August, again, picking up with a lot more precipitation. And so that really translated into much higher EEE activity, where we had 17 veterinary cases being reported in 23, along with 5 mosquito pools being tested. You can see here the counties where these 17 vet cases were being found within the state. And again, these included horses, emus, and alpacas. And emus and alpacas, shock for me. I didn't know we had as much emu farming going on in the state of Maine as we do. However, emu farming is apparently a cottage industry, but is fairly widespread in the state of Maine. And alpacas as well are also another livestock animal that is they're being raised in small scale agriculture, but very widespread across the state. When we take a look at 2023, we really had a focus in southwestern Maine, down here in York County, with a little touch over into Cumberland County later in the season. But our primary area of focus was central Maine. And this central Maine area is an area that we did see a lot back in the original 2009 Epizootic. And it is one that we are now recognizing as probably a fairly important foci. Previously, a lot of our work is concentrated in southwestern Maine, where we have abundant red maple swamp systems and where a lot of our early activity from 2001 through 2009 occurred. But in the last few years, central Maine seems to be an area that is heating up as far as EEE goes. And we had quite a bit of activity going into what I would consider as our true autumn in the state of Maine. And you can see from some of this data here, looking at some of the various farms where we had livestock fatalities, we're talking about dates now starting in September, but easily going into mid-October in those parts of the state. For us, this is a real shock. On the one hand, because one, we're in the middle of October and we're in Maine. We're in central Maine, not very far from Mount Katahdin in some cases. These are areas that we historically would have been covered by hard frosts by this point of the year. And that has not been happening in the last several years. And so as a consequence, our mosquito season is now extending. We are having mosquito collections even to some extent positive mosquito collections now going into October in parts of the state that are far removed from our southern borders. Going into 2024 regionally was also a very busy year for Eastern. You can see from this map here from the federal CDC that in the northeastern U.S., we had a lot of activity going on in upstate New York, as well as Connecticut, Massachusetts, New York, lower New York, and New Hampshire, and then also Maine. So overall, it was again a fairly busy year. And so with the onboarding of JCV testing in 24, provided capacity for us to do that virus as well on top of Eastern and West Nile virus. Our collections in 24 extended across 89 sites, across 38 towns in 11 of our counties. This was an increase from the previous year's activity in 23. We had over 1,300 mosquito pulse submitted for testing at our state health and environmental testing lab. And during the course of the season, we were able to find EEE, JCV, and West Nile virus detected in mosquitoes. And the one thing, again, this talk is mostly about Eastern. 2024 proved to be kind of a conundrum of a year for us because, as I'll go into, even though we had a lot of activity going on from the vet perspective, and eventually one human case, we actually had fairly low numbers of mosquitoes relative. And I think this is also going to play into the importance of weather and specifically precipitation in our Eastern activity, that we see. Statewide diversity, you can see we have a fairly wide spread of different mosquito species that we collect, but a lot of these are considered either enzootic or bridge vectors for Eastern. And so a lot of these are ones that are actually tested for the virus. And again, our ability to take a look at northern Maine as well begins to extend our surveillance into parts of the state that historically have not had a whole lot of data collected. If you take a look in Maine at a lot of the historical data for mosquitoes, there are two very large areas. One was around the University of Maine campus in Orono, and the second was around Acadia National Park. And that historically going back to the 1930s is where most of the mosquito collection data has occurred within the state. However, our work in being able to expand our surveys into southwestern Maine, down to the New Hampshire border, all the way up to northern Maine, near the Canadian border, have allowed us, at least in some areas, to begin collecting long-term data. And so based on this, we can actually begin to take a look at how the numbers of some of these species might look in comparison to a lot of our baseline averages. And you can see going back to 2022, again, that very, very extreme dry year, we actually had, by and large, substandard numbers of melanora being collected. However, in 23, once we began to have higher amounts of precipitation, our melanora numbers really were above historic seasonal averages that you would expect. And I think this is a directly contributing to the viral activity. One of the papers published out of the Connecticut Agriculture Station with Ted Andriatis and Phil Armstrong, they really talk about how important melanora is. Melanora being the primary key factor for Eastern activity to occur. And I think that those years where we have above average melanora are going to be really telling. Now, in 22 and 23, again, dry year versus a wet year, we also had our bridge vectors were also similarly affected, with sub-average collections of Coquetidia perturbans collected in 22, but above average in 23 when we had higher amounts of rain. And I think the other reason I really want to put this data in is because, I think in general, monitoring programs, long-term data collection programs don't get as much press, don't get the coverage of how important this data collection is. And when we're talking about these massive, large umbrella issues that you can talk about landscape change, you can throw in terms like climate change, you really need your long-term data in order to look at this and try to tease out what's actually happening across large swaths of area. Unfortunately now, the way our funding works, we have funding for projects that may last a year, 2 years, 3 years, which doesn't really give us a long-term look at what's going on in the landscape. And so I think having the long-term data and the long-term monitoring is pretty key for teasing out kind of long-term patterns with these viruses. Avian surveillance also occurred in Maine in 2024. It was our first year of really concerted avian surveillance since 2006, when our quote-unquote dead bird submission program was discontinued in Maine. And what we actually saw was that as birds are being found by the public, um, over half of them that had died in either residential or urban areas, were being found to still be positive for West Nile or Eastern. And you can see from this table here, the makeup of the different species that tested positive for Eastern. And again, they kind of run the gamut of really looking at gallinaceous birds like wild turkeys, to an occasional raptor, such as a barred owl or a Cooper's hawk, to songbirds, such as American goldfinch or American crows. We did, as a side note, we did have much more West Nile activity reported in birds in 2024. That was not what we saw, however, in livestock cases. However, IF&W, like many of us, sort of became a victim of their own success in that in finding these positive birds, that certainly increased press coverage of EEE and West Nile activity in the state of Maine, but also increased submissions to their program of further dead bird collections. And so it really also behooves, I think, the statement that, really the funding is pretty key to getting a good surveillance program going. And I think having a multi-pronged approach to surveillance, again, covers as many bases as possible. But again, that's not cheap. And one of the real issues we deal with in Maine is that for what we have for resources to work with, we're a large state geographically with a lot of area to cover. And it really, it's tight. Sometimes the budgets are tight for testing for a variety of different agencies working on this. And it proves to be one of our greatest challenges. Geography is really one of our big hurdles in the state that we have to wrestle with from a surveillance and resource perspective. So we had over 30 animals were submitted for testing. Livestock animals were submitted for testing at a combination of the Health and Environmental Testing Lab in Augusta, Cornell's Animal Health and Diagnostic Center, or the National Veterinary Services Laboratory in Ames, Iowa. And you can see from this that 18 of those 30 tested positive for Eastern. Most of these were centered in north central Maine. One horse was determined to be infected with Eastern and West Nile virus. We did have one horse survive infection. Most of the horses that succumbed to EEE were actually unvaccinated or partially vaccinated. And this does get into another sort of underground issue that we have in the state of Maine, which we do see in other infectious disease issues, vaccine hesitancy. And of course, we all know about the ideas of vaccine hesitancy that cropped up during the COVID pandemic and how people did not or were very suspicious of mandatory COVID vaccines. But we do have a subset of our agricultural community that is very hesitant to be employing vaccines in their livestock. And I think that it really means that we have to really be much better about our outreach and education, because in many cases, these are very small scale agricultural farms. And, not being a horse owner myself, I was a little sticker shocked at realizing that equines could go for as little as 5 to 8 grand up to $30,000, and which is a significant expense for a small scale agriculture. And the idea of not wanting to invest in your animals with a fairly inexpensive vaccine that only costs about $100 per dose, really seems a little short-sighted. But I think it does mean that we need to really be better about communicating how effective these vaccines are at protecting horses. And again, a two-dose vaccination will really protect this animal for the season. The other thing that we do know with the equine vaccines, the equine vaccine is a dual West Nile and Eastern vaccine. It does have off-label use where both alpacas and llamas, as well as emus, may be covered and partially protected by the vaccination. And so this has been used by some farmers in the last year in the state with some success. We had one farm that reported that vaccination of their emu herd occurred after an initial animal tested positive and died. And despite the fact that other nearby farms that were unvaccinated had animals dying, this one farm managed to protect the rest of its herd with the equine vaccine in their flocks. Human surveillance, we had over 100 people tested for EEE or West Nile virus at both Heddle and then confirmation at Fort Collins, but also commercial labs. 3 in the state tested positive for either EEE or West Nile virus. The one lone eastern case occurred fairly late in the season, in the month of October. It was a person in their 60s who, as of December, was still hospitalized with the virus. And it doesn't look like there's going to be a favorable outcome for this. Again, speaking to the severity of EEE infection in humans. And so, again, talking about why we're seeing EEE and why we're having it in areas of the state that are considered new or a departure from our historical positive areas, I think we need to tie in weather. And if you look at weather patterns in 2024, areas on the map shown here, again, this is data derived from the Northeast Regional Climate Center, areas that are in yellow are areas that had less than average precipitation, areas in green slightly above. Some of these areas that this is data going from 7/1 to 9/30 into October and November, areas that are in yellow on this map, some of these actually were classified as drought conditions going into November, which is still in effect now, even though it is winter with substantial snow cover. The actual base water content in the soils is still below average. And so we are going into the spring within a possible drought situation. But in the part of the state that had a lot of EEE activity, we actually had above average rain. And where all of our viral activity occurred was within this belt in Maine where it is shaded in green. This belt, obviously, you can see extends all the way into New York. And if we were to take this pointer and go over to Lake Champlain in Vermont, this is also the area where the state of Vermont had all of their EEE activity as well in 2024. And nothing occurring in parts of southern Vermont down here. Nothing for us occurring in where most of our historical EEE activity is occurring in southern Maine as well. And again, looking at non-human detections by week, you can see that again, most of our stuff is occurring in Maine, latter half of the summer into early fall. Now, we're looking at this and contrasting this too with a slide I'm going to show you in a bit, showing how this contrasts a lot with our 2009 Epizootic. But for 2024, again, most of our activity is occurring within central Maine, with a high amount of activity in farms around them. We have one as well bordering on Aroostook County, which gets into our northernmost county, where there has not been any previous activity reported in the state until this last year. And so again, when we look a little bit more in depth, one of the things that we are seeing is that this year, in 2024, many of these farms, which are highlighted by animals on this map, are actually farms that have had positive animals as well in 2023. And I think what that is telling us is that we have EEE established in these areas now, and we are looking at our area of central Maine being an area of what might be viewed as a permanent foci. This is a part of the state where we're working very closely with Allie Gardner's lab at UMaine. They're helping us with a lot of the mosquito collections. And these areas, especially around the town of Bradford, are areas that are pretty remote. They're areas, however, that are largely undeveloped with some small-scale farms, but otherwise almost entirely forested wetland areas in lowland areas. Upper elevation are rocky ridgelines, but those lowland areas are covered with forested wetland dominated by red maple swamps, which is going to be, again, one of your high habitats where you're going to see a lot of eastern occurring. The town of Bradford as well is also where we had our human case come up in October. Again, the one thing I will say is that we were able to detect our lone positive mosquito sample for the year came out of the town of Bradford. And this was about 2 weeks before the eastern case was detected. But again, it was a surprise because we're talking about October is when these were actually detected. We had very little mosquito activity prior to that. And of course, in a traditional year with Eastern, we would expect to see our mosquitoes becoming positive as early as the middle of August, historically in Maine. And so I think what we are seeing again is just a general trend away from our summer season extending into our falls because our falls are getting milder. And again, this is again just showing again that band of precipitation that we had in the state in 2024, which I think was really the real driver for us in the state. And I think it means as well for surveillance purposes, we need to not be as locked into having static surveillance locations. Again, given the large size of Maine, it makes travel difficult sometimes, but I think we need to be thinking more in terms of having mobile surveillance locations and essentially kind of like storm chasers following the rain. We need to be tracking where the rain is occurring and maybe adjust accordingly. However, that doesn't necessarily work for some of our surveillance techniques like resting boxes, but light traps are certainly something that we can employ to much better efficiency, I think, if we're following the precipitation patterns and doing surveillance from that. And again, when you look at this map going into 2024, all the red stars are where all of our surveillance locations are occurring. And some of these are our long-term sites. These are sites that we have based on previous activity for EEE. And you can see where that green swath of precipitation is. And guess what? It's nowhere near covering where our traps are placed at the beginning of the season, where we were expecting to find EEE. And so again, I think that really speaks to being very open to moving and being much more mobile in our surveillance practices going forward into 2025. So this map is a little more complex, but this is actually data that I pulled together looking at our initial 2009 epizootic versus 23 and 24. And what we can actually see is that in 2009, one of the real things that jumped out at me from the data is that our October temperatures on average, based around central Maine, our October average temps were in the mid to low 40s. This is important because the Fahrenheit temperature for mosquitoes, the cutoff is around 48 degrees. Below 48 degrees, mosquitoes are not active. They don't fly. What we're seeing in the latter part of these years, starting in 2021 and 23, our October temps are at or above 50 degrees on average, which is allowing our mosquito season to extend later into the season. And again, this is occurring in central Maine. So this is an area of the state that is fairly north. We have not yet looked, but I suspect that when we look at our southern Maine regions, going Augusta south, we're going to see even higher temperatures, which is also going to explain why we are getting much higher mosquito numbers going into the middle of October now. And so as a consequence, we're actually shifting a lot of our surveillance patterns. Now, rather than having a 3-month surveillance season, we're starting in May and going through the 3rd week of October, almost to the end of October. So that's almost a good 5+ months of mosquito surveillance that we now have to conduct in the state. And again, taking a look at when these epizootic activity is occurring. When we look at 2009, shown in blue, we had a fairly tight window of weeks 29 to 36 of EEE activity occurring in livestock. 2023, our activity really started around week 36 and extended to week 42. 24 was a bit milder overall. We started to have activity in livestock being seen on week 20, epi week 26, but again, extending into epi week 41. This right here, we're talking about October. And again, I think it really just drives home why we need to be really thinking about extending our season, because we certainly do now have periods of risk going into what we would historically think of as our cold autumn. And the mean hard frost dates, which I don't have plotted here, but the mean hard frost dates in 2009 for the state were around September 21st in 2009. In 2023 and 24, those mean hard frost dates were extended to the 1st week of November. And so I think, again, as we do more of this work, we begin to get more data that really, I think, leans into issues with climate change. I don't want to use the term global warming, but I think that you can't, we really do have a strong argument that climate change is actually at work when we're talking about these mosquito-borne viruses. And again, this is just an overall graphic from our Maine Health Department showing our years of activity from 15 to 24. And again, overall, for both West Nile, JCV, and Eastern, you can see that 23 and 24 were much more active years comparatively. And so just broad observations in 23, our largest recorded epizootic of Eastern was occurring among large domesticated birds, primarily emus. It was the first year that we had Eastern, JCV, and West Nile detected in a single season. It was also our furthest north detection of veterinary activity occurring in central Maine. And we had the highest number of counties reporting arboviral activity in a single season. And again, jumping to 2024, we had a very similar pattern. However, our northern extension now of viral activity is farther north to the town of Stacyville on the border of Aroostook County. Our latest detection, 2024, beats 23 by having a detection a week after in October 23rd. And we have our furthest northwest Nile virus detections as well occurring in 2024. So important questions, of course, are what is it going to be like for 25? That's one of the big questions we get in both the tick world as well as the mosquito world. And really we don't know. A lot of this is going to depend on Culicida populations and the amount of precipitation we're going to be getting once the snow melt departs. We're going to have ample breeding habitat occurring in these freshwater forested wetland crypts. According to Armstrong and Andreatis, publishing a paper in 2013, they looked at historical risk factors, but they included above average rainfall, mild winters, and greater amounts of EEE during the previous years. And we actually have two of the three right there that we can check. So I think we're going into the season with a possible heavy year for EEE if we get enough precipitation going forward through the months of May and into June. This is a massive project, and you can see here from the acknowledgement that we have a lot of different partners that we work with. But there really is a big shout out to our crew at Maine Health, doing on both mosquito collections, mosquito identification, as well as data analysis, but also our partners with Swamp Inc., as well as the University of Maine at both Stephen Hansen's lab and Ali Gardner's lab, and then the folks up at the Aroostook Band of Micmacs as well. And so that's it. That's what I got for a talk. I would be happy to take any questions.
Great. Thank you, Chuck. So with that, I'll open it up to questions. Feel free to unmute or raise your hand. And yeah. Go ahead, Alyssa.
Hi. Thank you, Chuck. That was very interesting. As a horse owner and as having that property in Greenbush that did have the positive EEE and West Nile.
I wasn't going to say anything, but
yeah, that was me.
Yeah.
So I did have a question though, because I was interested in the under-vaccinated horses and what constitutes under-vaccination. Because I know right now the veterinary, or at least my vet, recommends just getting a single EEE West Nile vaccine in the spring.
Mhm.
And I was wondering, those horses that were under-vaccinated, when were they last vaccinated? Were they
Yeah,
vaccinated in the spring or the prior year?
prior year, with the assumption that there's be a holdover of vaccination protection. However, if you talk to our state vets, they are really, I think, recommending that you have two doses during the course of the season, one in the spring and then possibly a booster in July or going into August. One of the things that was surprising to me was the off-label use in emus being very protective. And the fact that we had one of the farmers document, and the thing I should mention too, and Alyssa, you probably know this as well, with the EEE West Nile vaccine, you don't need to have a veterinarian to apply it. You can buy them right over the counter at many farm stores and apply them yourself. So it's a fairly, how much does it cost? Because you're a horse owner, right? So what does the vaccine run for a dose?
It depends because they're often like combo ones,
Yeah.
but I would say anywhere from like $30 to $60.
Which, for those of you that have pets, that's a pretty cheap vet bill. If that's a really inexpensive veterinary resource or veterinary cost. So I think it's a really good investment, And we did have the one farm though that talked about starting to actively vaccinate after one of his birds tested positive and not having any subsequent birds coming sick. So I think it's important, to really keep up with those second doses. And I think the shocking thing to me about the vaccine hesitancy, there was a slide put in here. You may have seen the word Amish. That was actually not my slide. That actually came from someone at the state health department. I'm actually a little uncomfortable just breaking out that particular community but I think overall we do have in Maine a very much a quote unquote back to the land movement. You might refer to it as granola crunchies or whatever, but there is sort of this perception, that in some cases the vaccines are not effective or they may cause more harm. But I think in this case, really the data speaks for itself that they're pretty effective. at protecting your horses.
Thank you.
Yeah.
Andrew, go ahead.
Yeah. So actually, Alyssa, I just have to ask, was the fact that that was detected any at all related to you being involved?
No, we've been using my property for years.
Okay.
And so I was just surprised because that was the first year I'd actually brought my horses home to live at my house. And then that was the year that we had the positive detection. So I did go ahead and vaccinate them, give them a booster that fall. But no, we've been using the site for even before I started working for Allie.
Yeah.
Oh, funny.
Yeah.
Yeah. So Chuck, thanks. Just thinking about what this means in terms of public health surveillance. Because we're kind of used to thinking these, 5 to 7 year cycles of EEE activity and kind of ramping up for the next big year, but having a lull in the middle. If we start seeing stacked seasons, that's going to really change everyone's kind of surveillance.
I think one of the things that we need, one thing I didn't mention because I don't have actual slide data because it's sort of an odd thing right now, is that discussing sort of the public health response to this in terms of the surveillance. And I think for those of us that work in the field, that we're actually working with this project, including our state vets, our state epis, we realize how serious this could possibly be. And I think that it was a little disconcerting to see that we had some difficulty getting the state executive offices to actually, declare public health emergencies in the state. Because part of it is Maine's a big state, and our geography doesn't do us any, it doesn't benefit us in this case because we have to drive a lot and we have a lot of gaps geographically in the data, and I think it means that we ideally, we got to think of creative ways to get more coverage, because you don't want stuff slipping through, it's difficult to, and it really forces you, I think, to, you kind of think that, oh, you've been doing this for so many years, you really know what you're doing. And then EEE shows up in a completely new area, not where you've been trapping for many years. And you're like, oh God, am I really doing my job well? I don't know, so.
Yeah. Good. Thanks.
Yeah.
No, go ahead.
Hi, Chuck.
Hey.
Great talk.
Thanks.
Great to see some of these overall trends. We're looking at EEE in Rhode Island and not nearly at the same scale geographically as Maine, but we are seeing that similar shift more inland. And noting that you said, historically you didn't see EEE before 2001, and that's kind of the coincident timing with West Nile. I went and seeing the trap locations looking like they're mismatched. Our situation is that, we've got a whole surveillance program that really was put in place for West Nile virus.
Right.
And so I'm wondering, is that what you're also seeing, that these trap locations were designed to surveil West Nile and there actually are really important ecological differences with doing surveillance for EEE?
Yeah, I think that's true because I think when West Nile first appeared, we really didn't know where we would really want to start looking. And I think for us initially, like you end up chasing the dead birds almost. You have to you're trying to figure out where you're going to be trapping to pick up virus. But in a lot of cases, if you're finding initially dead birds in an area, that tells you transmission's happening, and I think it was almost by luck that we happen to have somebody in that part of the state that found that initial goldfinch that tested positive, because it would not be an area that I would think it would be as hot for West Nile virus. It really would look like something, that would be an eastern site, but the same thing we could argue with Powassan virus. Our initial human cases of Powassan virus that were detected in Maine back in 2000 were only picked up because of interest in West Nile virus, and these people were dealing with neurologic issues. And when their samples were submitted for testing, they came back as negative for West Nile. And so other arboviruses were screened, and lo and behold, we ended up having 4 human cases of Powassan virus occurring around 2000 as well, right about the same time. So I think that the West Nile surveillance program actually did help to jumpstart a lot of our other data into some of these other arboviruses.
I just have one more question if I can. I think that's a really excellent point, and it kind of also drives home the importance of surveillance for identifying emerging threats.
Yeah.
Yeah. So my other question is simply, how is this relationship with the farmers, like especially since it's a lot of small scale operations, how does that actually work with getting reporting into Maine Med for, dead animals, or is there mandatory reporting, or how is this managed?
I think we have certainly heard. So again, I should say the way this works in Maine, it's a little bit of an odd situation because you may have noticed, and those of you that don't know me, we actually are part of a hospital, but our Maine State Health Department, Maine CDC, doesn't have active surveillance staff, and so we sort of provide the active surveillance for that. So we work closely with our state ag department, who's dealing with a lot of livestock questions, and there is certainly some hesitancy about reporting sick animals. We certainly have had reports in 23 of one of the farms that I can think of. We actually did not get the first 2 animals that died. This was their 3rd animal that they finally submitted for testing. The first 2, not wanting to call attention to themselves, just put them out in the pasture and, got rid of the carcasses, and so I think that it really, because I think unfortunately there's a lot of suspicion, and we're certainly seeing people being very suspicious of science. And I think that comes down to as well, some of the ag industry, they don't want to be labeled as a quote unquote hotspot for disease with their animals. And so there is some hesitancy about reporting as well. There's no penalties if they don't, but certainly, I think it behooves them to get on board and work with the state ag department if they have sick animals. And the one thing I'll say too about this last season that it strikes me in the back, and I had this thought in the back of my head that if we had as much Powassan virus activity occurring in the state of Maine, you would have heard a lot more about it. I think in Maine in general, we don't worry about mosquitoes as much as we should. Ticks still freak people out. People are really bothered by tick-borne disease, but I think mosquitoes are just considered to be quote unquote part of the landscape. They've just always been here. They're a nuisance. You just put on your bug repellent and just ignore it. And I think one of the conversations that we need to shift a little bit is that, yes, while mosquitoes have always been here, these viruses probably have not, and the viruses themselves are a new situation. And I think we need to be better about communicating the fact that the viruses are new, because one of the arguments we hear with ticks is, well, we never had ticks 40 years ago, but we do now. And I think one of the things we need to be hammering home is that, we didn't have these viruses here 40 years ago, but we do now. And going forward, we're not, I don't see why we would get rid of them. They're part of the landscape now. And I think we just need to also be better about communicating the risk.
Any other questions?
I do have another question.
Yeah, go ahead.
All the question time. But I was really interested in the kind of phased mosquito surveillance program that you presented, because as you know, in many states, it's just all the mosquitoes all the time.
Yeah.
And it really bogs down in terms of manpower and cost to do testing on everything. So I think it's kind of, low-key brilliant to just say, let's do more strategic testing. How does that, do you find that actually helps with bringing down the cost resources?
The one thing I think last year it was great that we had JCV testing finally brought on board in the state of Maine. The one thing I did not like about it was that we suddenly had to start IDing black-legged 80s in abundance, being collected from light traps at the end of May. And for those of you that don't ID mosquitoes, black-legged 80s, man, it's a nightmare. They are horrible to identify, and you get a lot of them at that time of year. And I think that being able to just test the enzootic vectors for the Eastern and West Nile end, it's very streamlined. It certainly saves a lot of time, both ID time as well as shipping and also testing time as well. Because the amount of mosquitoes we could collect for JCV testing based on all the vectors and their abundance, it could skyrocket very easily, and that would be kind of a very broad kind of swath of mosquitoes to collect versus the enzootic vectors for Eastern and West Nile. I think we should probably have a support group for black-legged 80s in the Northeast, but I don't know anyone that wants to do that yet. So, but.
All right. Thanks again, Chuck.
All right, guys. Thanks. See ya.
All right. Take care.